What is Jardiance used for? Jardiance is used along with diet and exercise, and sometimes with other medications, to lower blood sugar levels in adults and children 10 years of age and older with type 2 diabetes, condition in which blood sugar is too high because the body does not produce or use insulin normally. Jardiance is also used to reduce the risk of stroke, heart attack, or death in people who have type 2 diabetes along with heart and blood vessel disease. Jardiance is also used in adults with heart failure to reduce the risk of needing to be hospitalized and death due to heart and blood vessel disease. Jardiance is in a class of medications called sodium glucose cotransporter 2, SGLT2, inhibitors. It lowers blood sugar by causing the kidneys to get rid of more glucose in the urine. Jardiance is not used to treat type 1 diabetes, condition in which the body does not produce insulin and, therefore, cannot control the amount of sugar in the blood, or diabetic ketoacidosis, a serious condition that may develop if high blood sugar is not treated. Over time, people who have diabetes and high blood sugar can develop serious or life-threatening complications, including heart disease, stroke, kidney problems, nerve damage, and eye problems. Taking medications, making lifestyle changes, e.g., diet, exercise, quitting smoking, and regularly checking your blood sugar may help to manage your diabetes and improve your health. This therapy may also decrease your chances of having a heart attack, stroke, or other diabetes-related complications such as kidney failure, nerve damage, numb, cold legs or feet, decreased sexual ability in men and women, eye problems, including changes or a loss of vision, or gum disease. Your doctor and other healthcare providers will talk to you about the best way to manage your diabetes. How should this medicine be used? Jardiance comes as a tablet to take by mouth. It is usually taken once a day in the morning with or without food. Take Jardiance at around the same time every day. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take Jardiance exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Your doctor may start you on a low dose of Jardiance and increase your dose as needed. Jardiance helps to control your condition, but does not cure it. Continue to take Jardiance even if you feel well. Do not stop taking Jardiance without talking to your doctor. What special precautions should I follow before taking Jardiance? Tell your doctor and pharmacist if you are allergic to Jardiance, any other medications, or any of the ingredients in Jardiance tablets. Tell your doctor and pharmacist what other prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if you are on dialysis. Your doctor may tell you not to take Jardiance. Tell your doctor if you regularly drink alcohol or sometimes drink large amounts of alcohol in a short time, binge drinking, or are on a low-sodium diet. Also, tell your doctor if you have or have ever had urinary tract infections or problems with urination, low blood pressure, high cholesterol, pancreatic disease including pancreatitis, swelling of the pancreas, or have had surgery on your pancreas, yeast infections in the genital area, or kidney or liver disease. If you are male, tell your doctor if you have never been circumcised. Tell your doctor if you are eating less due to illness, surgery, or a change in your diet, or if you are unable to eat or drink normally due to nausea, vomiting, diarrhea, or if you become dehydrated from being in the sun too long. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. Do not breastfeed while you are taking Jardiance. If you become pregnant while taking Jardiance, call your doctor. If you are having surgery, including dental surgery, tell the doctor or dentist that you are taking Jardiance. Alcohol may cause a change in blood sugar. Ask your doctor about the safe use of alcoholic beverages while you are taking Jardiance. You should know that Jardiance may cause dizziness, lightheadedness, and fainting when you get up too quickly from a lying position. If you have this problem, call your doctor. This problem is more common when you first start taking Jardiance. To avoid this problem, Get out of bed slowly, resting your feet on the floor for a few minutes before standing up. Ask your doctor what to do if you get sick, develop an infection or fever, experience unusual stress, or are injured. These conditions can affect your blood sugar and the amount of Jardiance you may need. What special dietary instructions should I follow? Be sure to follow all exercise and dietary recommendations made by your doctor or dietitian. It is important to eat a healthful diet and exercise regularly. Follow your doctor's instructions about drinking enough fluids throughout the day while you are on this medication. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effects can this medication cause? This medication may cause changes in your blood sugar. You should know the symptoms of low and high blood sugar and what to do if you have these symptoms. Jardiance may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Urinating a lot, including at night. Increased thirst. Some side effects can be serious. If you experience any of these symptoms, call your doctor immediately. Frequent, urgent, burning, or painful urination. Urine that is cloudy, red, pink, or brown. Pelvic or back pain, fever, nausea, or vomiting. In women, vaginal odor, white or yellowish vaginal discharge, may be lumpy or look like cottage cheese, or vaginal itching. In men, redness, itching, or swelling of the penis, rash on the penis, foul-smelling discharge from the penis, or pain in the skin around the penis. Feeling tired, weak, or uncomfortable, along with a fever and pain, tenderness, redness, and swelling of the genitals or the area between the genitals and the rectum. If you experience any of the following symptoms, stop taking Jardiance and call your doctor immediately or get emergency medical treatment. Rash. Hives. Itching. Difficulty swallowing or breathing. Swelling of the face, throat, tongue, lips, mouth, or eyes. Hoarseness,